Holt, as you probably know, I've been a practicing pharmacist for over 40 years and recently retired, but I'm still going to be going back to work at my old job here after we get done with the session a little bit. You know, I was sitting here thinking, in my practice, I can think of 2 minors right now that are receiving gender-affirming care at my pharmacy. I think one is a 16-year-old male, and I think maybe about a 15-year-old female, but I can't remember. If this bill passes and is signed by the governor, can you tell me what impact that will have on their care that is being provided by their physician here in the state of Iowa and the pharmacy that I work at?
Well, Representative Forbes, I know you've read the bill, and I know that you know that they would have 180 days for the doctor to either refer. Perhaps it would just be up to the family to make a decision as to how they proceed, but they would have 180 days to make those decisions.
And what would that decision be?
I'm not going to make speculation. They have 180 days to make decisions.
Well, I think in my interpretation of the bill, I think they would have to stop treatment at 180 days.
I don't think that's necessarily true.
You don't?
No.
So I could continue to dispense prescriptions for testosterone and progesterone injections to these 2 minors without running into any legal ramifications?
No, I think there's possibly the opportunity of referral to other doctors in other locations. There's the opportunity for the young people to wean off of these drugs because, again, we're concerned about the efficacy and the safety of these medications long term. And the mountain of evidence suggests everything from osteoporosis to heart conditions.
I know both these patients have probably been doing this for, I know, way over a year or maybe 2 years. And so stopping therapy, I think, could be very detrimental to both these individuals that have, started the process and now have been told by the Iowa legislature that they cannot no longer receive this therapy. I think that is very damaging to an individual's liberty and justice here in the state of Iowa.
And we are very concerned about the damage that these medications do based upon a mountain of evidence.
Yeah, and being a pharmacist, I understand all the side effects of hormone replacement therapy, but you talk about all the negative things, but there are positive effects from these drugs too. And I think the positive effects are much greater in the long run for people than the negative things that you've referred to.
I would disagree.
Okay. How about if one of my patients decides to go to the state of Illinois to a physician there and they bring a prescription back to a pharmacy here in the state of Iowa? Can that pharmacist legally fill that prescription for that patient?
I am really not going to go down that road, Representative Forbes. All of these hypothetical scenarios, you can read the bill, you can see what the bill says. You can make a decision on the hypotheticals. I'm not going to go back and forth with you on those.
Well, I think that's important to know as a healthcare practitioner. If I'm going to be in violation of state law here in the state of Iowa, I think it should be spelled out in the bill what the penalties are if that does occur.
I believe the bill spells it out.
So what would happen then?
Again, you can read the bill. I'm not going down the road with hypotheticals. You can see it gives 180 days. You can see it has a measure for which doctors can face sanctions if they refuse to follow the law, or medical professionals. You can make your own decisions after that based upon the hypotheticals that you create in your mind.
What about if a parent takes a child to Illinois and they get a physician there that will prescribe or do therapy? They fill the prescription in Illinois and have it brought back into the state of Iowa. What's the consequences for that for the parent?
Read the bill, Representative Forbes. I'm not going down the hypothetical road with you.
Okay. Well, those are questions I think we need answered on the floor today.